Hello and welcome to the latest updates on COVID-19 from Tokyo. Emergency has been declared in Japan for Tokyo, Osaka and 5 other virus hotspots. Facing a worried nation on the brink of a potential dramatic spike in novel coronavirus patients, Prime Minister Shinzo Abe on Tuesday pleaded with residents to stay home to protect their lives to counter what he called the biggest crisis since World War II. The declaration, which became effective the same day and will continue until at least May 6, the end of Golden Week holiday, also covers Saitama, Kanagawa, Chiba, Hyogo and Fukuoka prefectures. Noting that the country's healthcare system is increasingly strained, Abe asked people to change their behavior by cutting back interactions with others by between 70 and 80% for a month. In the rate of infections remains the same in Tokyo, Abe warned that the number of patients could balloon to 10,000 in 2 weeks' time and 80,000 in 1 month. The situation is getting desperate, he said. The declaration authorizes the governors in the 7 prefectures to request that residents stay home except for essential tasks such as grocery shopping and seeking medical care. As for businesses, the prefectural governments would also be able to request that they thoroughly implement infection control measures. Tokyo Governor Yuriko Koike requested that residents of the capital with a population of more than 13 million isolate themselves until May 6, starting at midnight Tuesday. However, basic infrastructure like electricity, water supply and gas, as well as businesses such as supermarkets, convenience stores, drugstores, banks, post offices and public transportation will not be impacted by the declaration. Abe assured lawmakers that the government would not request train and airline operators to reduce their services. At the same time, he called the prospect of the government directly compensating all individual enterprises affected by the declaration unrealistic, highlighting other supportive measures such as financing and cash payments for small and mid-sized businesses. The governors would additionally be able to ask that schools, universities, childcare facilities, movie theaters, music venues and other facilities temporarily close. If institutions disobey the requests, prefectural governments could then instruct them to close and also disclose the entities' names, essentially shaming them publicly. But there are no other penalties against such refusals. Even under a state of emergency, prefectural governors do not have the legal power to enforce extremely restrictive actions and cannot lock down cities like in the US or Europe or India. Such requests from the prefectural government are understood to be taken as a demand with a strong expectation that those asked will obey the directives. In the event of a surge in patients, prefectural governors would also be able to request to build temporary medical facilities and could do so forcefully if a landowner refuses. Abe on Monday said the government would bolster the nationwide capacity for polymerase chain reaction test to 20,000 per day. This is also called PCR test. And also increase hospital beds that prioritize the treatment of patients with serious symptoms from 28,000 to 50,000. Abe has also asked hospitals to secure about 15,000 ventilators to treat COVID-19 patients and push manufacturers to increase production as soon as possible. Thank you and keep watching.